Hello and welcome everyone. Thank you for joining today's presentation by the Health Connector and MassHealth, where we will share information about health and dental coverage options. The name of this presentation is Health and Dental Coverage Options for Massachusetts Residents Losing Access to Employer-Sponsored Insurance. We will get started shortly. Hello and welcome everyone. I'm Melissa from the Massachusetts Health Connector. I'm joined by my colleague Thalia and our MassHealth colleague Belkis, who will be presenting today's information. In attendance, we also have Ashley from the Health Connector and Abby from MassHealth, who will be supporting with questions. Together, we are here today to share information about the health and dental coverage options available for Massachusetts residents. We'd like to take a moment to thank our community partner organizations and elected officials across the state for their support in promoting this webinar, including our partners in the state legislature and our congressional delegation. Before we get started, just some information about our presentation formats. Everyone's audio has been muted and the video has been turned off. The presentation portion will last approximately 30 minutes, then we'll have time for a question and answer period. If you would like to ask a question at any time, please use the Q&A button at the bottom of your screen. We'll be monitoring questions throughout this session. However, we are expecting a large audience and several questions, so we'll do our best to get through them all or address them by themes. Also, feel free to scroll through the Q&A as your question may have already been answered. Please do not share any personal information or private health information when you ask your question, as others on the call are able to see what you write. If you have a personal scenario that you want to discuss with someone, we'll be providing contact information for the Customer Service Center and instructions on how to find help from a local assister. We are recording today's webinar. Following today's session, you'll receive an email with the presentation, so there's no need to take detailed notes. So let's get started.
All right, hello and welcome everyone again. As the title of our presentation suggests, today's presentation will be focused on health and dental coverage options for Massachusetts residents who are losing or might have already lost their employee-sponsored coverage and are exploring their options for health coverage. Oops, 1 second. Okay. So during today's presentation, we will go over the difference between MassHealth and the Health Connector, how we differ, and the populations that we serve. We will then move into some commonly asked questions for each organization. Then Belkis will go over some application requirements, as well as coverage options for MassHealth, and I will do the same for the Health Connector. We'll review some application deadlines for when you should apply for coverage. And lastly, we'll go over a few ways to get free assistance with the application process. Okay, and now I will pass it over to Belkis so that she can give us an overview of MassHealth.
Thank you, Thalia. So we're going to be we're going to go through a MassHealth overview, and then I'll pass it back to Thalia to go over the Health Connector. Next slide, please. Thank you. For MassHealth, there are populations that we serve, and we typically put them within two buckets. For those that may not know, MassHealth provides health benefits to qualifying children, families, seniors, and people with disabilities residing in the state of Massachusetts. We may also provide assistance in either covering your full benefit or helping to pay for part of your health insurance premiums through some of the programs that we offer. MassHealth members do have access to doctor's visits, dental coverage, prescription drug plans, behavioral health services, and other important healthcare services. For the purpose of this presentation, we're going to be reviewing criteria for individuals and families, but know that if you are coming up to being over the age of 65, we do have an application for seniors and people needing long-term care services and supports. For individuals and families, typically folks that fall under this bucket are individuals under the age of 65 who are living in the community and not residing in a nursing home facility. If you are under the age of 65 and in a nursing facility, you would complete our senior and long-term care service application. Other individuals who fall under the umbrella of individuals and families are folks of any age who are parents of children under the age of 19 or adult relatives living with or taking care of children under the age of 19 where neither of their parents are residing in the household. For our over 65 individuals or seniors and people needing long-term care services and supports, is typically individuals over the age 65 and older who are either living at home in the community or individuals who need long-term care services and supports, and those are individuals of any age. There may be individuals who are eligible under certain programs that need long-term care services and supports within the community, and they fall under some of our waiver programs. And this may include individuals with disabilities. Also, if you are part of a household where you're a spousal couple, where one individual is over the age of 65 or someone is under the age of 65, you can also complete our senior application. Next slide, please. So I will pass it back to Thalia to go over the Health Connector.
All right. So the Massachusetts Health Connector is the state's health insurance marketplace, and we offer health insurance coverage to individuals, families, and small businesses. We offer coverage options to those who don't have access through their job or a spouse's job, or if they do not qualify for mass health coverage. For those who have lost their health insurance through their employer, their Health Connector is an alternative to COBRA coverage. Those who come to the Health Connector may qualify for help paying for their coverage, and some may be eligible for $0 monthly premium payments. And although we won't discuss this in detail during today's presentation, I did want to mention that Massachusetts residents are also able to purchase dental coverage through the Health Connector. We also have a separate platform called Health Connector for Business. This is a separate platform for small businesses with 50 or less employees who are looking to provide their employees with health benefits. If you are interested in Health Connector for Business, we have a separate webinar that goes over this program in more detail. Let me move on to the next slide. Sorry, having a little trouble here. Okay. So what we would like for you guys to take away from this section is that although MassHealth and the Health Connector work together, we are two separate organizations who share one application. That means that when you go to apply for coverage, you will only need to complete one application that will determine if you're eligible for MassHealth or the Health Connector. You do not need to specify which program you are applying for because the system will make that determination based on the information you enter in your application. The application is also available in a couple of languages, including English, Spanish, and Portuguese, if that is your preferred language. So just to highlight some of the main differences between our organizations, MassHealth, is Massachusetts Medicaid and CHIP program. They provide free or low-cost health coverage to eligible individuals. Eligibility is based on income, age, disability, and other factors. It is administered by the state and funded by state and federal governments. And different from the Health Connector, they have continuous enrollment throughout the year, meaning you do not have to wait for an open enrollment to start your coverage. The Health Connector is an online marketplace for insurance plans. You'll find plans available from all the leading carriers in Massachusetts on our platform, which will help you shop and compare your options all in one place. We have available plans for individuals and families as well as small businesses. Eligibility for the Health Connector is based on your income and family size, and eligibility will vary. And the Health Connector does have time frames and deadlines for enrollment, which are our open enrollment periods and our special enrollment periods, which we will talk about a little bit more in another slide. So now we will pass it back to Belkis, and she'll go over some commonly asked questions for MassHealth, and I will do the same later for the Health Connector.
Thank you. So a few questions that we often get asked is first, do you need to live in Massachusetts to apply for MassHealth? The short answer is yes. The caveat is that in order to be considered a Massachusetts resident, you can, as long as you intend to stay in Massachusetts, whether you have a fixed home address or not, you can still apply for coverage. We do ask that you provide us with a valid mailing address, and that may be a P.O. box. So there's no restriction in regards to that. So being a Massachusetts resident means that you plan on residing in Massachusetts. You are not considered a resident of Massachusetts if you are here on vacation or are here to receive special medical treatment in a setting that's outside of a long-term care facility. Do you need to renew your MassHealth coverage? Yes, you do, on an annual basis. So every year we do ask our members to complete their application just to ensure that we are up to date with all of the information that we have for anyone applying, as well as ensuring that they are getting the best benefit that we can provide them or that they may be eligible for. Many of our members are auto-renewed, meaning that they may not even get an application. We may determine their eligibility based on the sources and the information that we already have on file. But for those members where we are unable to automatically renew their application, they will receive a blue envelope in the mail in order to complete a pre-populated form, which is just a pre-filled out form where they would review the information, and it typically comes in a blue envelope. What happens if you get a new job or there's a change of employment throughout the application process? So MassHealth members are required to report any changes within 10 days of those changes transpiring. So if you lose your job, you need to report that right away. And that is not only to ensure that we have the most up-to-date information on file, it's also to make sure that you can get the best benefit that you're eligible for. So the sooner you report the information, the better. Some of the ways in which you can complete those changes is by either calling us, doing your online application and updating it there, or you can complete our job update form and submit it to us, and we can make the updates for you. The next question is, what do I do if my income changes throughout the course of the year? You can update your application at any point in time just by logging on to your online application. And then you can reference some of the links that we have in our slide deck that you will receive at a later time. And it provides you information on how you can make those changes. Also, keep in mind, whenever in doubt, you can always call us at 1-800-841-2900, and we can update your application at any point in time, as well as answer any questions that you may have. So with that, I will pass it back to Leah to go over their frequently asked questions.
Thank you. So one of the questions that we've been getting a lot recently is, are there other coverage options besides COBRA? And yes, alternatives to COBRA could be MassHealth if you are eligible, a plan through the Health Connector, or other group plans like a spouse's plan through their employer, or you could choose a plan directly from an insurance company. You could choose to go with COBRA if that is the best option for you and your family, but you might find that at some point it might become a little expensive and there are other options that are more cost effective. Next question is, can I get help paying for my health insurance if I buy a plan outside of the Health Connector? And the answer to that is no. The only way you can get assistance paying for your health coverage is if you go through the Health Connector. Savings through the Health Connector could be through advanced premium tax credit or our Connector Care program. Now, if you wanted to purchase health insurance through the Health Connector but not receive any assistance, you could also do that. It's still a great place to shop and compare plans since we do have all the leading carriers in Massachusetts available on our platform. Next question is, can I drop COBRA at any time and take up the Health Connector coverage? There are some circumstances when someone enrolled in COBRA can end that coverage and take up Health Connector coverage, including during the Health Connector's open enrollment period, which starts in November, during a special enrollment period, which could be triggered by any life changes, like changes in your income, getting married, or having a baby. You could also switch over once a former employer subsidies end or the full term of COBRA coverage ends. And then the last question that we get often is, if I get health insurance from my job, can I cancel my Health Connector coverage? And the answer to that is yes. Sometimes people use the Health Connector in between jobs or until they are able to get coverage from another source. Once you have coverage elsewhere, you can just call the Health Connector and cancel your coverage. Just make sure to do it by the 23rd of the month so that you are not charged for that for the following month. All right. Okay. So we've briefly touched on COBRA coverage a few times during the presentation, but I just want to go over this chart so that the timeline and options are laid out clearly. So once you lose your employee-sponsored insurance, which could be your last day of work or the last day of the month you were employed, you will trigger a special enrollment period that will allow you to get coverage with the Health Connector. So this part is important. You'll have a 60-day window to take action. That's 60 days before losing employee-sponsored coverage or 60 days after losing coverage. And then you'll have a couple of options to choose from. You could do an alternative ESI plans for those under the age of 26. That could be joining your parents' health plan, or it could also mean joining your spouse's or partner's employee-sponsored plan. There's also COBRA, which will always be offered to employees and will allow you to stay on the current insurance you have with your employer. The catch here is that you will be responsible for paying the full premium amount for the plan, which can get expensive. And then the last option on this chart is coverage through the Health Connector or MassHealth, depending on what you qualify for. Choosing between coverage options will all depend on your circumstances and what works best for you. So for example, some employers will help you with the cost of COBRA, the COBRA plan for a certain period of time, let's say 6 months. And if you know you'll have an alternative coverage within those 6 months, you might choose to stick with COBRA. I'm just going to repeat that again. You don't want to miss this window. So you'll have 60 days to take action. And after that, you may have to wait to get coverage elsewhere. So as soon as you know that you're going to lose coverage, I would just start exploring options. Okay, and so now I'll pass it back to Belkis to go over the application requirements for both MassHealth and the Health Connector.
Thank you.
1 second, sorry.
Okay, so as previously mentioned, when you're completing an application, You're just completing one application in order for us to determine whether you're eligible for MassHealth or the Health Connector. Typically, the way it works is that you will be determined first for MassHealth eligibility, and if you're found ineligible, you will then see if you're eligible for a Health Connector plan. So when you're reporting any changes or making updates to your application, just know that you will find that you're either eligible for MassHealth or the Health Connector just through that one application that you're completing online. The difference is that once you see the results of what you're eligible for, you would then call the appropriate customer service line to finalize your enrollment into a plan. So you can always go to the mahealthconnector.org online application, and there you will see that you're eligible for either MassHealth or the Health Connector at that point in time once you complete the application. Next slide, please. So who should apply? If you are a resident of Massachusetts, you can apply for coverage. If you have U.S. citizen, U.S. national, or otherwise lawfully present in the United States, whether you have an immigration status or you do not, you can apply for MassHealth. There are certain rules around immigration status for our respective programs, but if you have an immigration status or no status, you can always complete an application. If you are enrolled in Medicare or other public health coverage, you may still qualify for a benefit. For MassHealth purposes, if you have Medicare, you can have MassHealth as a supplement as long as you're found eligible through the rules that we have based on income, age, and a multitude of additional factors. If you are offered affordable comprehensive health coverage from an employer, you may still qualify for MassHealth because as I stated earlier in this presentation, MassHealth can assist you in the cost of your healthcare premiums, whether that is we will help you cover your full premium, act as a supplement, or assist you with part of your healthcare premium depending on the costs and additional factors through some of the programs that we offer. If you do not have health insurance, you can apply. You just have to meet the additional criteria as far as living in Massachusetts, having a status or no status, and make sure that you're including all members in your household, and you can still apply for coverage. Next slide. So who should not apply? As mentioned before, if you are just visiting Massachusetts, whether that's for personal pleasure, such as a vacation, or just to receive specialized medical treatment outside of a nursing facility, you cannot apply for benefits because you are not considered a resident of Massachusetts. There may be additional considerations, such as if you are eligible for other comprehensive health coverage, including Medicaid or Medicare, you will not be eligible for the Health Connector. People who are in jail or prison can apply for MassHealth before their release, but are not eligible for MassHealth or the Health Connector while they are in present state incarcerated. Next slide. So who should be included in the application? Please bear with me because it's a very extensive list. And we get asked a lot of questions about who should be included on an application. So for the purposes of MassHealth and the Health Connector, you should include the people in your household. You need to tell us about the household members who live with you, as well as those household members that you file taxes with and are claiming as dependents, whether they live with you or not. We need to know about those individuals. Keep in mind, you do not need to file taxes to get MassHealth, Health Safety Net, or the Children's Medical Security Plan if you qualify. So who to include? You have to include yourself, your spouse if you are married. If you have any children, whether they are biological children, adoptive, or stepchildren, you should be including them on your application. For those of you that are not married but live with children who are under the age of 19, you need to be including your children as well as your unmarried partner. So if you are living with your domestic partner and you share children, that person should be included on your application because you're both mutually responsible for the children that you are applying for coverage for. Make sure you include the children under the age of 19, as well as anyone that is on your tax return, even if they don't live with you. So if you are claiming tax dependents and they are not currently residing with you, you still need to include them because we do base part of your eligibility based on your taxes. Anyone who you include on your tax return should be listed, as well as anyone who is living with you or you take care of who's under the age of 19. So think a younger sibling if you are the adult responsible for that sibling. People who you should not include. So if you are living with your partner and you do not share any mutual children and you're just living together, you do not need to include them on your application. We don't add our domestic partners on things unless we share children. And then obviously, if you have a change in status as far as marriage, then at that point you can add them on your application. But if you do not share any children together and you're just living together, you do not need to include your domestic partner on your application. You also do not need to include that domestic partner's children, again, if you don't share any children together, because there's nothing tying you to that relationship if that relationship were to end. So we do not need to include those individuals. You do not need to include your parents whom live with you if your parents file their own taxes and do not claim you as a tax dependent. We have seen several times where parents have children that just graduated college and their college graduates still live in the home, but are now working, have their own income, and no longer being claimed on that parent's tax return. So you don't need to include your parents if they're not claiming you on taxes and you're over the age of 19. You also do not need to claim your elderly parents if they are living with you and you're living together but not claiming them on your taxes and vice versa. And you also do not need to include any adult relatives who you do not claim as tax dependents. Next slide, please. So what do you need to apply? And these are just some things that are helpful as you're navigating the application process. Is just to simplify your life, but it's not all encompassing. So if you have a social security number, make sure that you have that information of all of those that you're including on your application as long as they have one. If they do not have a social security number, that is perfectly fine. You don't need to provide one, but you will need to check off on the application the reason why someone doesn't have a social security number. And that can be that you applied for a card and are just awaiting for that card to arrive in the mail. You may not be eligible for a social security number based on your immigration status or lack of a status. So that may be some of the reasons as to why you don't have one. You also need to provide recent pay and income information, have copies of your pay stubs available. If you are self-employed, your tax return with your Schedule C showing your self-employment income. Those are just a few examples of proof of income that we may ask of you. You also should have available proof of address, such as a copy of a lease, a mortgage statement, a utility bill, such as a gas or electric bill. For those that have immigration status, have your documentation available, and that can be anything from your immigration cards, forms, if you're awaiting a status change, any of that information would be beneficial. Also, you can still apply if you do not have a status, so you do not need to provide that information if you don't have one. You may also need to include any health insurance that you're enrolled in. So for those that are on Medicare, or maybe you have a job where you have insurance and you need assistance in paying for those premiums or looking for a supplement to that insurance. So make sure that you're providing your insurance information. You may be eligible for MassHealth if you have health insurance. So don't be afraid to provide that information at the time of application. Oftentimes, we do try to verify all of these factors electronically, but we may ask for additional documentation once your application has been processed for any proofs that we may need from you. Next slide. So what is the best way to fill out the application? First and foremost, please make sure that you are answering all of the questions for all members listed on your application. If you do not, we may need to ask you additional information in order to process the application. So make sure that you're just double checking that you're checking off all of the boxes and the prompts that are provided throughout the application to make sure that you're completing everything so that your application can be processed in a timely fashion. When reporting your income, make sure that you are entering your gross wages. So that's everything before taxes are taken out. You also need to include your weekly hours worked. If you are someone who works bi-weekly, monthly, bi-monthly, you just divide your hours worked on that pay stub based on divided by 2 if you're bi-weekly, if you're bi-monthly, divided by 2 as well. Also, you have to provide your pay frequency. So how often you are getting paid, whether that's weekly, bi-weekly, monthly, annually, if you're a contract worker. When reporting your yearly income, please do not write NA or not applicable. We recognize that people may not be working at the time of application, so it is better that you enter the number 0 or write 0, the word, income on the yearly income line, because otherwise we may still ask you for that information because you may have lost your job today and it's June 11th, but you earned an income up until this point. So just keep in mind that when we're asking you for your yearly income, we're talking about the income you earned throughout that period of time in which you're applying. Also, make sure that you're signing and dating your application. If you're completing it via paper, we ask for you to sign, print, and date the application. But if you're doing it online, it captures your e-signature, your electronic signature. We also accept electronic signatures on our paper applications. If you're doing a PDF, we accept the digital signature. We also accept verbal signatures over the phone. So you can complete the application over the phone, and because it is a recorded line, we will be recording your consent to sign the application verbally. If you need any assistance applying, there are enrollment assisters, or you can go to one of our MassHealth enrollment centers to seek assistance. Our enrollment assisters are located across the state of Massachusetts, and we can provide you some of those resources later on in the application. And your job isn't done once you complete your application. You may be asked for additional information. So once your application is processed, we hope that we can verify everything electronically, but if we are unable to, you may be asked for additional information. So make sure that you are looking through all of your mail. Sometimes we send too much mail, but please make sure that you're reading each one just to make sure that you don't miss anything and that you're not missing any deadlines or any action items that we may be requiring of you. So make sure that you're submitting your application and documents within a timely fashion. Submit everything on time because you always run the risk of either losing your benefits or getting a downgrade in benefit if you don't submit your information in a timely fashion. So next slide, please. So what happens after you are approved for MassHealth or the Health Connector? So once we receive all of the information, we will make a decision and let you know what you're eligible for. If you are approved for a benefit, we will let you know if you qualify for either MassHealth or the Health Connector via noticing that we may send. If you complete it online, the great thing is that it tells you right then and there once you submit your application. Unless there are additional things that we need of you, then we will provide you your determination once those documents are submitted. If you are found eligible for MassHealth, you will receive a blue MassHealth ID card to show at all of your doctor's appointments. You may need to enroll in a health plan. So not all doctors just accept MassHealth. you may need to select a plan through plans that we offer in order to get your services covered. So you can do that through MassHealth Choices so that you can compare and see what plans are available in your area. Once you are enrolled in a health plan through MassHealth, you will receive a white card to display at all of your appointments, as well as have your blue MassHealth ID card available. You will need to report any changes such as to your job, income, household size, or immigration status within 10 days of those changes happening. So, like I said, your job isn't done just once you are applied and are found eligible for a benefit. Any changes that transpired throughout the course of that application, you will need to report in a timely fashion to make sure that you're still eligible. And also keep in mind that every year you will have to complete a renewal form. It is a requirement of ours, and that is again to ensure that the information that we have is accurate. So I will pass it to Thalia to go over what the factors are for the Health Connector.
Okay. So once you've received your application and any additional information that we request from you, you will receive a determination online and you will receive a notice through mail as well. If you are approved for the Health Connector, you will be able to compare plan options through the online portal. You will be able to see which insurance companies are in your region and the different costs for each of these plans. Before you select a plan, you'll be able to search through the available plans to make sure that your preferred doctors, hospitals, or clinics and your medications are covered by the plan that you select. Once you have compared your options, you'll then select a plan, and when you want it to start, you'll then have to place it in your cart for checkout. Please keep in mind that if you owe a premium at checkout, you'll need to make that payment by the 23rd of the month for your coverage to start on the 1st of the following month. So just the key takeaway here is that MassHealth and the Health Connector have slightly different shopping experiences. And I will pass it over to Belkis to go over some of MassHealth's coverage options.
So if you are found eligible for MassHealth, you may be eligible for one of the following coverage types. The first and most comprehensive is MassHealth Standard, which offers a full range of healthcare benefits such as doctor's visits, dental, vision, behavioral health services, and so forth. If you're not found eligible for MassHealth and you are an individual with a disability, a verified disability, you may be eligible for what is called Common Health, which covers a full range of healthcare benefits as well. It's just geared specifically for individuals who are not MassHealth Standard eligible, but have a verified disability, and that is for both adults and children. Followed by Care Plus, and this is typically for adults who do not have any children and are not found eligible for MassHealth Standard. It again covers a full broad range of healthcare benefits, just like the other two that were previously discussed. Next is followed by family assistance. And individuals who find themselves in this category are typically children, individuals with HIV positive status or breast or cervical cancer who are not found eligible for MassHealth Standard. But again, it still offers the same broad range of services for doctor's visits, dental, and vision, as well as more comprehensive benefits. Keep in mind with the four that were just discussed, you may need to enroll in a health plan. So you would have to follow that process if you are found eligible for that. And then the last three coverage types that we have are not considered health insurance for purposes of taxes. First, it's MassHealth Limited, and it is exactly what it sounds like. You don't get a comprehensive set of benefits. You can receive emergency services as well as services at a community health center, followed by Children's Medical Security Plan, which covers primary and preventative medical and dental services to certain uninsured children. So this is specifically for children who are not found eligible for any of the other benefits that we discussed. And lastly is health safety net. And this may help pay for certain services that you can receive at an acute hospital or community health center, as long as you're a resident of Massachusetts and are either uninsured or underinsured, meaning your insurance does not cover all of your medical necessities provided. So with that, I will pass it back to Thalia.
All right. So the plans offered through the Health Connector are a bit different from MassHealth. All the plans offered through the Health Connector meet state and federal standards for coverage, which means that you will get comprehensive coverage when you shop through the Health Connector. You'll be assured a plan that covers essential benefits like preventative care, doctor's visits, hospital stays, and prescription medications. We offer qualified health and dental plans from all the leading insurance companies in Massachusetts. The Health Connector is the only place where you can get help paying for your coverage, and that may happen one of two ways, either through advanced premium tax credits or one of our Connector Care plans. With the advanced premium tax credits, you could save money on your monthly premium by taking those tax credits and sending them directly to the insurance company. There is also our Connector Care plans for people in lower income ranges who meet other eligibility requirements. These Connector Care plans are low or no cost health insurance plans. So our Connector Care plans are unique to Massachusetts and have lower premiums, lower copays, and no deductibles. Eligibility for Connector Care plans are based on income and household size. So for an individual, that income limit for a Connector Care plan in 2025 is $75,300, and for a family of four, that limit is $156,000 in 2025. And if you do not meet these income limits for a Connector Care plan, you might still have the opportunity to save on your premiums through the tax credits. All right, when to apply and enroll. So we always encourage people to apply for coverage, even if they are unsure which plans they qualify for, or if they've missed some deadlines. We say this because if you fill out the application and are found eligible for MassHealth, your coverage could start right away since MassHealth does not have an open and closed enrollment period. Now, for the Health Connector, we do have enrollment deadlines. We are currently in our closed enrollment period. During this time, you'll need to have a qualifying life event that will open up a special enrollment period for you to shop for a plan with the Health Connector. Life events that could open up that special enrollment period are, again, changes to your income, address change or a change to your immigration status, having a baby, or losing insurance, the insurance that you get through your job. You could report any of these life changes you should report any of these life changes within 30 days of it happening, and then you'll have those 60 days from the date of the life event to select a new plan. And payment and enrollment deadlines will still apply during this special enrollment period, meaning payment is due by the 23rd of the month and coverage will start on the 1st of the following month. Okay, how to get help. And then I will pass it back to Belkis.
Thank you. So where can you get help? For MassHealth, you can always contact our customer service at 800-841-2900, and they can assist you with any of your MassHealth questions, as well as completing an application over the phone. You can also visit one of our 7 enrollment centers located across the Commonwealth. And I believe on the next slide, it'll have the full list of those centers. And then you can also schedule a virtual appointment with one of our eligibility specialists, and they can assist you with the application, any changes that you may have. Then I'll pass it to the Leah real quick for the Health Connector aspect.
Okay. So this is the slide that Belkis was talking about where it just shows all the locations. And then here we have some more free resources available for through our community partner organizations that are available to help with the application process in person. We have certified application counselors as well as navigators across the state who are ready to answer any of your questions about eligibility, payments, plan options, and they speak many different languages, so they can help you in whatever your preferred language is. You can also find a certified application counselor or navigator on the Health Connector's website by clicking the link Get Free Help near you on this slide, which we will be sending out after this presentation. And we will take any questions now.
Okay, awesome. Thank you so much. Okay, so a reoccurring question that keeps coming up is who to include in the household.
Okay, so I'm gonna try to tie it up in a bow as best as I can, because it is a bit nuanced, but typically we always start with taxes first. So if you are a tax filer and you're claiming a tax dependence, you always need to include the folks that are on those taxes, whether they are living in your household or not. The next category of people that you want to make sure you're including are any spouses and children that are living in your household, who can who should be on your application. And again, same thing, whether they are applying or not. If you are living with a domestic partner and you are sharing mutual children, you need to include that person as well as the children that you both share, as part of your application. Keep in mind that you would not include your domestic partner if you do not have any mutual children living with you in the household. So that's just something to keep in mind. You also do not want to include any parents who are not being claimed on taxes, especially if you're over the age of 19. So if we're thinking like current day family dynamics, you are two parents, you have an adult child who graduated college and is now working and getting their own insurance, and you're no longer claiming that adult child on your taxes. You do not need to put that adult child on your application. But if you are claiming that adult child, you need to include them on your application. I hope that helps.
I hope so too. Thank you. All right. And also, can you please go over if someone has inconsistent income, what is the best thing to do and what should they submit on the application in that case?
I always say look at your taxes. And I'm thinking specifically for folks that are self-employed or maybe have contract work. It's always best to kind of refer back to what you're getting on your tax return at the end of the year, or just keep like a tally of what that looks like. Once you have a sense of what your yearly income is, you have the option of reporting it as a yearly income. So you can just type in what you earned for the year. If your income is stable-ish or you have an idea roughly of what you're making, whether that's biweekly, monthly, include that figure. Keep in mind that we will try to verify that information electronically. So even if you're kind of providing a guesstimate as to what you're roughly getting throughout the course of the year, you can provide that information. If we're able to verify it, great. That's the last thing that you'll have to do. You will get a benefit. But if there are additional things that we may ask of you, keep in mind you will have to provide proof if we're unable to verify it electronically.
Great, awesome, thank you. And then someone wanted some more information on if we can elaborate on how the APTC works.
So basically, when you go into your application, it will tell you if you are eligible for a connector care plan or if you are eligible for the advanced premium tax credits. With the advanced premium tax credits, it will basically show you the amount you are eligible for. Once there, you can determine how much you want to put towards your premium, which you can do the full amount or you can do less depending on how your income might fluctuate, because that will depend if you owe money to the IRS or you get money back at the end of the year. But that money will go directly to the carriers from the IRS. You don't have to do anything else. Melissa, I don't know if you want to add anything else about that process.
No, you answered perfectly. Thank you so much. All right. Okay, let's see. All right. Someone asked, do we offer vision?
Yes, we do. It is limited on included with the health insurance plans.
Perfect. And then we have some questions regarding Medicare. Can we also touch upon what those members should do if they're Medicare eligible?
So you can still apply for coverage if you have Medicare. It's just that you would essentially be applying for Mass Health, because you cannot have other health insurance and be eligible for the Health Connector. So if you meet our eligibility criteria, you would have your Medicare plan, which would be considered your primary insurance, and then Mass Health would act as a secondary. So we would supplement whatever Medicare doesn't cover, and that's just not in, it's not just in regards to health insurance benefits, meaning like your primary care doctor's visits, dental, vision. There may be additional programs that you can have access to depending on your healthcare needs and what you require in order to remain healthy and independent.
Okay, great. All right, let's see. And then we had a few questions regarding if you are a Massachusetts resident and you happen to visit outside of Massachusetts or you're a college student, what happens then? Are you still eligible or can you talk about that a little bit more?
I will try.
I know it's complicated.
It is very complicated because we are a state Medicaid program, so we cover services within the state. What I will say is that if they're receiving any and all medical care here in the state of Massachusetts and their home address is here, they can still access their health information. We do recognize that things happen outside of the state, whether you're not even just in college, you're on vacation, and those are viewed on a case by case basis as to whether we are able to cover those services or not.
Okay, great. And then we have a question about connector care and how it relates to other health connector plans.
Not sure if I understand the question, how it relates to other health connector plans. Because we do have our small business platform, but we have the same plans. The same plans that are offered on our connector care plans are offered on our small business platform as well. I don't know if that answers that question.
Yeah, I can jump in here. I passed that along to Melissa because I was seeing a lot of questions in there about connector care. I think there were just questions about um, connector care as a program, like how you can qualify for connector care or what happens if you don't qualify for connector care.
So what happens if you don't qualify for a connector care plan? So basically, if you don't qualify for a connector care plan, you might still be eligible for the advanced premium tax credits, and you could save on your plans in that way. And if you don't qualify for either of those choice for those things, the advanced premium tax credits or the connector care plans, you could still go on to our website and purchase a plan from any of the carriers that are available on there. And basically, all the plans will offer the same services. The only difference will be that some will receive assistance paying for them and some will not.
Thank you. I think that answers a lot of the questions that we were getting about that.
Great. Thank you so much for including that. All right. And another question here, would losing a job or change in income count as a qualifying event?
Yes, it would.
Okay, great. Okay, let's see. Sorry, guys. All right, we have a question here. This person plans to retire end of August. They want to know if they would include, oops, sorry. Sorry, guys, bear with me. There are a lot of questions, and we will try to get to as many as possible, but if we are unable to, we will definitely, if you can refer to the customer service number, they're coming in very quickly, so bear with me for a second. All right. All right, here we go. If you collect unemployment currently, but work for several months this year and got a severance, should you use total income for that? Does that affect what you can get for health insurance, even if it's been months not working?
So in our application, I believe, and someone please correct me if I'm wrong, when we send out the slide deck, this part of it is included as a resource on how you would report your income. So you can select multiple income sources when you're reporting your income. So in this case, because you are currently receiving unemployment, you would select unemployment as an income source. And then for severance, typically it's provided as a one-time lump sum payment. So you can select other income and indicate that you're receiving it the one time and put in the full amount that you're receiving. The system itself will do the calculation to determine what you are eligible for in that regard. But then when it comes to the yearly income that you're reporting, you would obviously have to add those yearly figures together to make sure that the system calculated your income correctly. Is it possible? Can someone pop up the slide deck and refer to that yearly income slide just so that people can kind of see what they can do in terms of reporting their yearly income? Okay, so this slide is referring to how you can select and report your income. So as you can see, you have several options, one of them being unemployment in the top. For me, it's on my top right-hand corner. And then other income is still on the right-hand side, but towards the bottom. So you can select those two income sources to report your income. Then you would continue forward. And you also have the option of selecting no income. And then the next slide, please. So this is to report that one-time only income that I was talking about. So when you select the other income, you can then write in other and type in however you receive that severance. So you can just write severance. And then for frequency, select one time only and then the amount that you received. And then the next slide. So then once you did all of that, you selected your appropriate income sources, you can report the yearly figure. The system will do a calculation, and if you do not agree with the number that they're providing you, you can always select that, no, this isn't accurate, and then you would type in what you earned for the year between your severance and your unemployment benefits. And you will also get these slides later so that you can kind of look through it and see what it looks like. And as you're doing your online application, it'll make a lot more sense when you're entering in your information.
Okay, great. Thank you so much. So this concludes our presentation today. Just a reminder that we will be sharing the presentation and links, but not the Q&As. Thank you all for joining our webinar today from everyone at the Health Connector, MassHealth, and all of our assisters across Massachusetts. Be safe and well, and goodbye.
Thank you, everyone.
Thank you, everyone. Have a great day.